Get started. Again, thank you so much for spending your Saturday with us. We're excited to welcome you to the Ask the Experts special guest, Stacy, and she'll have a moment to introduce herself. But before we begin with our one-on-one interview with Stacy, we're going to go ahead and share what Ask the Experts is. So Ask the Experts was originally conceptualized by our amazing president, Leanne West. And she is not on this call today, but both Abby and myself are. So, just a quick introduction if you have not met me, my name is Sabina Goldstein, and I'm the executive director of iCAN. And I work very closely with Abby to ensure that all patient voices are heard in pediatric medicine research and innovation. And I want Abby to also do a little quick intro as well if you have not met her.
Perfect. So nice to have everyone on the call today. Thank you for spending a small portion of your Saturday morning with us. We're really excited about today's session. As Sabina said, my name is Abby Clark. I'm iCAN's Director of Operations, and work really closely with her and the rest of the team to make sure youth voices are heard and valued and understood in the pediatric realm.
Perfect. Thank you so much, Abby. So, Ask the Experts, any age participant is welcome to join. As you may notice on this call, we have kids on the call and we have adults on the call as well. We will give preference to the kids who ask questions, but of course, feel free to ask questions in the chat as we're going on through the session, but also feel free to ask them orally. We love when people go on unmute and Stacy can hear your voice. It really puts it just puts personal touch to what you're asking. And so we also make sure that our youth can choose sessions. So some of you chose to go on the last month's session and now you're choosing to go on this one. You get to choose the sessions that best fit your needs. And we're super excited to have all of you on this session. I know a lot of you are interested in research, so this is literally such a great fit for you. And so with that, I'm going to go ahead and have Miss Stacy introduce herself, and she's going to talk about her background and just what she does in her career. So can you tell us a little bit about yourself and your background?
I would love to. Thank you for having me. Good morning to everyone here. It's a pleasure to be a part of your morning. So first, I live in Connecticut with my husband. I have two sons, 6 and 9, and I have a dog. Um, as a way of background, I was the first person in my family to graduate from college. I did go to college in Hartford, Connecticut. I went to Trinity College and where I obtained a degree in neuroscience. And then I went to Columbia University in New York to earn my master's degree in nutrition. Was that a question?
Oh, no, no, no.
No,
So
okay.
I'm so sorry. So someone was on mute. We'll ask the questions after we go through all the
Okay.
questions. Yes,
Okay.
but feel free again to put them in the chat. So sorry,
Sure.
Stacy.
No, no problem. And so I also think that it's always helpful to know kind of more personal aspects of a person's life, because we are all more than what we do for work. And so I love to cook, I love to travel, and I really enjoy spending time with my family.
I love that, Stacy. And we actually have one of our youth council members, and she's a leader of the youth council as well. She attends Trinity College. So there's that
Oh,
similarity there. Awesome.
that's fun.
And then I'm going to go ahead and hand it off to Abby to ask more about your career and then other questions as well. Go ahead, Abby.
Sure. If you don't mind just introducing your career a little bit, that would be great. And
Sure.
then the follow-up question is, when you look back on your career, did you always see yourself working in this field, or was it something you discovered over time?
Yeah, great. Thank you. So the title of my role is Director of Research Process Improvement and Regulatory Affairs, which is a mouthful. And what it means is that I am helping support research at Connecticut Children's Research Institute, by implementing kind of process changes to support researchers as they have to go through a variety of different steps in order to kind of get their research off the ground. And I'm also responsible for overseeing the regulatory requirements for research one of which is the Institutional Review Board, which is my primary role and the bulk of my responsibility. So no, to answer the question, no, I did not. I'm sorry, do you hear a phone call ringing?
No, you're
Oh,
fine.
okay. I did not think that I would go into this as a kid. I didn't know this job even existed. Um, I will say that as a kid, as a fourth grader, I became really fascinated with medicine, and it was because of a personal experience that I had with my family. Hold on one second. And it's because as a fourth grader, my my sister, who was 21 at the time, was diagnosed with a tumor on her pituitary gland in her brain. And so I witnessed firsthand the experience that my sister went through, that my family went through. And the one thing that really helped put my family at ease was my sister's medical team. And so at that time, I set my sights on becoming a doctor. Um, like I said, no one in my family had ever graduated from college, so it felt very like a lofty goal, but that's the path that I had set on. Um, and just for everyone's awareness, my sister is healthy now. She has a family of her own, and she's navigated kind of the medical landscape since then. But that was the first time that I really saw firsthand what, obviously as a kid you go to the doctor regularly, but I saw the power that um and the peace that could come from a medical team of just the care that was provided. And so I I went through kind of high school and went to college with on the pre-medical track. I Because my sister's experience was brain related, I also was very fascinated with neuroscience. And so I specifically focused on neuroscience, which is the science of the brain. And during my time at Trinity, I assisted in two different types of research projects. One was with Dr. Sarah Raskin, who was looking at prospective memory, which is the ability to remember things that you need to do in the future. And then I also worked with Dr. Francis DeMario at Connecticut Children's on what families understood from the informed consent process. So that's a little glimmer into my my future. But that kind of planted the seed for kind of a research background. After I graduated from Trinity, I took a job in New York City at Mount Sinai School of Medicine with a research group who was studying traumatic brain injury. While I was there, I was preparing to take the medical school admission test. Um, and I worked as a research assistant in that group studying traumatic brain injury. Um, but after a little bit of time in that role, I didn't feel like it was the best fit for me for a variety of reasons. And a friend had just gotten a job in the Institutional Review Board office there. And she said, there's an opening here. Maybe you want to try this. And I think that's another kind of key takeaway is you have to be open to, kind of where your path takes you. And I wasn't particularly enthusiastic about the role I had. I didn't feel like I was learning a lot. And so I said, yeah, let me try it. And so I did. I took the job as an analyst in the Institutional Review Board at Mount Sinai. Um, and I didn't know then that I was going to spend the next 20 years working in this field. So, kind of to go back to the medical school path, if you're wondering, well, what happened to that? Um, I took the medical admission test. I didn't do as well as I had wanted to, but I did get accepted to medical school despite that. I was though still feeling a little bit on the fence as I weighed the kind of pros and cons. And I decided to defer my admission, so put off my admission for a year. And I then did a master's degree in nutrition because I was really interested in preventive health. And I thought nutrition would play well into that, regardless if I chose to become a doctor or not. And at the end of that time, I decided I didn't want to go to medical school. I didn't think that was the right fit for me for many reasons. And I just continued working in the IRB office and kind of climbed the ladder as an analyst, and I moved into a manager role and then into a director role, and kind of continued kind of building my experience and expanding my horizons as well. So no, I didn't know the job existed when I was kind of studying as a high schooler or undergraduate, and it kind of just I just fell into it, but it's something that has worked really well for me and my skill set, and has continued to interest me.
Thank you so much, Stacy, for sharing your journey and really sharing with our youth and the adults on the call today that sometimes your trajectory in life isn't what you originally thought, but it is what you're passionate about now. And that's what's the most important. And so, with that, a lot of our kids are actually very interested in research. They present research at our summit, but they do somewhat of informal research, sans IRB, so without IRB. So can you go into telling us more about IRB and how does it help keep kids safe in clinical trials?
I would love to. So an IRB, and many of you might know that this acronym stands for Institutional Review Board. And the purpose behind this group is to make sure that the rights and welfare of people joining research are protected. And this came into being in the 1970s because there were experiments that took place prior that really harmed people. And so the federal government thought we need to put something into place to help protect people who are participating in research. And so they enacted a set of rules and guidelines to help guide research to make sure that people were not harmed. Um, and the kind of basis for these regulations came from what's called the Belmont Report, and it articulated three main principles. One was respect, so giving people choice and obtaining informed consent. So, the iCAN group is giving youth a choice and a voice in the work that you're doing. So, same in research, it's really important to make sure that people know that they have a choice to participate, that they're given all of the information in order to make a decision to participate. The second principle is beneficence, so really to do no harm and to maximize the benefits and minimize the risks of participation. And justice, to really make sure that you're distributing the costs and benefits of research to the participants equally. So one group of people should not have to suffer from the risks of participating while another group gets all of the benefits. And so making sure that you're recruiting appropriately and equitably so that that principle of justice can be followed. And then so kind of going into the second part, which is how do we as an IRB make sure that people joining research studies are protected, is that we require that any study at Connecticut Children's that's involving human research participants goes through the IRB for review. And so what that means is that a researcher has to submit documents to us. And when we receive those documents, we have to review them for a variety of things. So as a researcher, they are required to create a protocol which outlines, what their goal is of the research, what their hypothesis is, what the inclusion criteria are, what the exclusion criteria are, what is going to happen as part of the research study, how they're going to analyze the data after the research study. And then we receive that along with other materials, and we have to go through the regulatory requirements and see, is it actually aligned with those principles from the Belmont Report? And so there's a variety of questions that we have to ask and analyze. And so principally is, are the risks reasonable in relation to the benefits? Are the risks reduced as much as possible? Are participants selected fairly and equitably? How will participants be informed about the study? What does that consent process look like? Will the interactions with people be private? Will their information be kept confidentially? And so we have to go through all of those things and evaluate the protocol and the other materials to make sure all of those things are met. Or if they're not, we have to go back and forth with the researcher to make sure that they are met. So providing guidance on how to revise their protocol, their approach to meet all of those requirements.
Perfect. Thank you, Stacy, for going into depth about what is an IRB and how does it keep kids safe. And so I know a lot of our kids also themselves participate in clinical trials. So just so you know, any clinical trial that you have been in has been sent and reviewed by our IRB. And so with that, I'm going to go ahead and hand it off to Abby.
Perfect. Thank you so much, Sabina. Um, so Stacy, what are some important ethical issues when doing research with children, and how do you make sure those issues are taken care of?
Sure. So, I think one thing to note is that the federal regulations have additional requirements for any research that involves kids. And so we have to take all of those additional things into consideration. And the two main things that we are considering, in addition to all of the other things that I just mentioned, is a more in-depth evaluation of kind of that risk-benefit ratio. And so, often in research involving kids, there might be a evaluation of a drug or device. And so we have to make sure that there's data that exists to support the use of that drug or device, which isn't approved, in the pediatric population. And so we have to evaluate all of the background information, the research that's been done to date to see, is this really something that should happen in kids? Um, and and if so, why? Provide a rationale for that. And we also have to think about, well, what are the risks to the kids that are joining this study? And is there a way that we can minimize the risks? So, for instance, maybe there's a drug study and they want to collect blood every day. And so then there's not just the drug that isn't an approved drug, but then you also are asking kids to come in and get their blood drawn every day and have to go through that experience, which some kids are really averse to. And so thinking about, is there a way to change that? Or maybe there needs to be more frequent blood draws and it needs to be combined with clinical blood draws so that there's less poking. Um, and so that's what the IRB is evaluating. What are the risks to the kids involved, and what are the benefits if there are any? Often there is no benefit to research. And so it's really something that parents need to really consider fully in partnership with the researcher, and with their own kind of clinical care team to evaluate if it makes sense for them to join if they have all the information that they need. And that kind of goes into the next point is consent and assent. So consent is the legal permission that a child, that not a child, that an adult or guardian gives to join a research study. So a parent or legal guardian is providing permission for their child to join a research study. But assent is the requirement that kids also have to have a voice in that process. So most of the time at Connecticut Children's, any studies that involve kids that are 7 or older requires assent, meaning that there needs to be a conversation with the child to say, this is what's going to happen. Do you agree? And if they say no, unless, and there's again certain circumstances in which the child doesn't get a voice in this process, but most of the time the child has to agree, and their voice supersedes the voice of their parent. Again, unless it's specifically for treatment purposes. um, so there are exceptions, but children do have a voice, and there's an expectation that there's a process to deliver that information in a way that kids can understand, and have that conversation and have them be involved in that process.
Thank you so much, Stacy. And we actually had someone talk about ethics on Ask the Experts not too long ago, and there's a lot of overlap with exactly
Yeah.
the three principles that you're talking about and incorporating that into exactly how you review these research studies. So I've never experienced someone raising their hand before during Ask the Experts, so I have to call on this person. And we're gonna
Yeah.
pick the questions right afterwards. But Pamela and Carl, did you want to share your question?
So yes, please. So I actually was part of, I got an offer to do one of the research studies with doing a blood draw, and I did not want to do it because of how much blood they were going to be taking.
Yeah.
So would there, like, how does that work? How would you be able to work around
There's
it?
not a workaround. If the child doesn't feel comfortable in proceeding, um, then the expectation is that they can't participate in the research study. So unless they're, the researcher is able to kind of get the family to a different place of comfort, then it wouldn't proceed. So, and the other option is that the researcher can revise their study potentially to say, okay, we're going to have one group of kids have this amount of blood drawn and one group of kids have this amount of blood drawn. And that process would go back through the IRB for assessment again before it could be offered back to the family. So in that circumstance, I hope that um, that they didn't proceed and that you landed on a place where you felt comfortable to proceed with what was going to happen.
So whose voice did they listen to?
They did listen to mine. My mom tried to get me to do it, but I didn't want to because of how much blood they were going to be taking.
And we respected it.
Thank
Yeah.
you for taking my question.
Yeah, thank you for asking it. And hi, Pamela.
Thank you so much, Tamala and Carl. And again, I love the real world connection. So making those connections when you do see clinical trials and they ask you to do things that you're not comfortable with, of course, you can question them and you do not have to be participatory in it. So thank you for sharing that personal experience. And so, with that, how do you make sure parents and guardians are fully informed and involved in the decision as part of the IRB, like Carl mentioned, to let their kids
Mhm.
participate in clinical trials? And why is it so important?
Yeah. So I think the informed consent process is a critical component of IRB review. And so I think that and with kids it becomes there's more things to consider of how the information is going to be communicated. So you see a lot of kind of innovative approaches to providing assent information over to a family. So some institutions have created comic book style imagery to be able to convey the story of a research study to a participant. And so what the IRB is doing is looking at the consent form, so it's a document, and often there's an assent form as well, that's a document. And again, it's depending on the age of the child. So we're reviewing to make sure, does it make sense? Does this language make sense? And then making sure that all of the elements are there. So we would expect that a consent form includes why they're doing it. Anyone wants to know why they're being asked to join the research study, that it's voluntary, that they can choose not to join and nothing will happen to them. What procedures are going to take place as part of this and what the expectation is as part from the family. So are you expected to come back here every day for once a week for the next 5 weeks? Are you expected to come back here every day to have your blood drawn? Are you expected to complete surveys? Um, what all of the responsibilities are as the research participant, knowing what the risks are of joining the study, what the benefits are. Like I said, a lot of research doesn't have direct benefit to the child or to the family. And so making it clear as part of the consent document, but also as part of the process, because it's not just the document. There's a requirement that the research team is having a conversation about what the research study is with the family and giving them time to read the materials, to go through it, to ask all of their questions. And that's a very critical component of the whole process. And then, I think most importantly, like I said, is that it's voluntary, that people know that they do not need to participate, and that their care will not be affected whether they choose or choose not to participate. And I think the other component is the assent process. So we have a template that we've created to help researchers in communicating um, the 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 meat of the research study over to a child using simplified language. And we also recommend, like I said, people be creative of what they think will work best with their population of kids. Um, and like I said, that typically at Connecticut Children's, we require that there's assent in place for studies involving kids over the age of 7. But that assent process might look different depending on if you have a 7-year-old versus a 15-year-old. And so they might have two different types of materials to communicate what's part of the research study. But I think the other, key piece besides the materials, again, is the conversation. So making sure um, that the research team has a plan for having the conversation with participants, and giving the participants time to answer questions about the research study and what will happen as part of it. I think that there's some other elements to this that might make this a little bit more complicated, now that we're in a more kind of remote research landscape where we can do research more remotely now. There's also some studies that are sending surveys out to families to complete, and there's not actually a verbal consent process. So the IRB has to assess, does that make sense for this study? Or, is all the information that's in the document sufficient for them to make a decision? Or does there need to be a verbal conversation to support it? And then the last piece is also that we have to understand what population we're reaching and whether or not English is the language that they're utilizing. Because if not, then we need to be able to support having those conversations in a different language, having materials available in a different language, and how to navigate, how to help the research team navigate that, because they don't necessarily have the resources within their own team to support conversation in multiple languages. So as a hospital, we do have resources to support um, communicating in a variety of different languages using kind of vendors that the hospital uses. So that is one helpful tool that researchers also have access to.
Perfect. Thank you so much, Stacy, for sharing all the nuances behind the assent, the consent, and also just meeting the needs of those participating. So that's important too, like language as well as other factors. And then I'm going to go ahead and hand it off to Abby.
Perfect. Thank you so much, Sabina. So, reflecting a little bit on your career, because, a lot of our kids and our young people on the call today are looking at maybe going to college or applying to universities, or starting to think about what they may be interested in pursuing. Can you talk a little bit about with your master's degree and your certification as an IRB professional, what part of your education has been most useful in your work?
Yeah. So my particular role requires a lot of time reading, a lot of time writing, critical thinking, and analysis. And so I think from a formal education perspective, attending a liberal arts college where I had to do all of those things regularly really helped kind of create this skill set that I needed to be successful in this role. And I think something else that's interesting about my role is that I am exposed to a variety of different topics every single day. So no research study is the same as the last one. And I have to often read through protocols that are very dense. So 100-page document that is not necessarily my content area. So I have a master's in nutrition, so that's an area where I feel most comfortable in. But I have to be able to read through a very dense protocol and extract the things that are important to be able to apply the regulatory framework. And so I think, again, that the skill set that I kind of got through my formal education helped in doing that. But beyond that, and I think that probably most would say experience has been critical. So I'm very different from as a reviewer of research proposals now than I was 20 years ago. And in order to become a certified IRB professional, you do have to have a certain number of years experience to even take the exam. And they do that because you really need to have experience in reading the regulations and applying them and be able to interpret. And so that has been really critical. The other thing is conference attendance. So continuing to get education because the landscape of regulations does change. And our interpretation of how to apply those regulations changes. And so going to conferences, annually, or more frequently if we can, and creating a network of colleagues that you can communicate with on challenges that you see or topic areas that you see and need kind of help with or is also a really important piece, I think, in any role, but has been really important in my role.
Wonderful. Thank you so much for Stacy for sharing all that. I think that key point there you brought up is making sure you're continuing to be educated and you continue to learn in whatever role that you go into in the future is such an important piece of not only personal development, but also making sure that you're continuing to connect with the people you're trying to help, the people you're working with. And it's such a wonderful aspect of being able to go out there in the working world and continue to learn. And it can also be very fun. So thank you so much, Stacy, for sharing that. I'll pass it off to Sabina now to, I think, start our Q&A portion.
Thank you so much, Abby. So as Abby mentioned, we're going to go ahead and start our Q&A portion of Ask the Experts. So I'm going to go through the chat. And of course, if I call on you, you can say it out loud. But if you don't feel comfortable, I will read it from the chat. I will start with Pamela and Carl. They were just referencing your story. I'll say that one. They wanted to know your inspiration story. Was it your little sister or older sister that experienced the tumor?
It was my big sister.
Thank you so much, Stacy.
Yeah.
And Joey, I'm going to go ahead to you. Do you feel comfortable going on unmute and sharing your question? Okay, I will ask Joey's question for him. So, what do you find to be the most rewarding part of your job?
Yeah. So, I had shared that I was on this kind of medical school track because I really wanted to be able to help people the way I felt like my sister's doctors helped our family. And so I've, I still, in my role, I'm not necessarily helping people directly on a day-to-day basis. I don't have, I'm not having conversations with potential participants on a regular basis. But I am indirectly, I think, helping move the research landscape and making sure that people are provided with the information that they need in order to make decisions about whether or not to join. So I think that's one thing that's important to me. And being able to be exposed to the breadth of research that's taking place at Connecticut Children's has been really inspiring to me as well.
Thank you so much, Stacy. And then Heather has two questions for you. Heather, do you feel comfortable going on unmute and sharing?
Why is there less research in psychosis in children compared to adults?
I think that's a great question, and I don't have the answer for you. At Connecticut Children's, I will say that the types of research is really dictated by the people who have the bandwidth to do research. And so there are certain areas that are kind of key areas as an organization that the researchers have time that they can dedicate to it, or they see the population that needs it. So, for instance, we have a lot of studies in Crohn's disease. We also have a lot of studies in hematology oncology. And so those are the kind of, from a clinical trial perspective, that's what we see the most of. And then there's a smattering of other things. I think it really depends on the people in the organization, what their expertise is, and what they have the bandwidth to be able to do in addition to their clinical responsibilities, at least at Connecticut Children's. So I couldn't speak more broadly than that. I'm sorry.
All right, thank you. And my other question was, how often do you test drugs on animals before testing them on humans?
Sure. I think that's usually the first step in any drug evaluation is testing on animals first, because we want to make sure that the mechanism of action is outlined. We want to evaluate what the risks are in an animal model before moving on to humans. And what you also typically see in pediatric research is that the drug has been tested in adults before being tested in children. So it's usually animals, usually I would say lab, animal, adult, and then child.
Thank you so much, Heather. And then I'm going to go ahead and call on Pamela and Carl to share their question as well.
I was just wondering, what was the hardest study you ever had to do?
That we ever had to review.
Yeah.
Yeah. I think that the most difficult types of research to review are ones that are less common scenarios for our organization. So we see what I would call standard clinical trials, like an evaluation of a drug or an evaluation of a device, pretty regularly. But things that kind of are on this kind of gray area of is it even human subjects research, which is something I didn't even talk about, but that's kind of our first step is saying, is this research involving human subjects? Um, is more complicated to understand the kind of how to apply the regulatory requirements. So research that's in the community, and not necessarily what you all might think of as a clinical trial, which is typically a drug or a device, is the most complicated to review and to manage all of the moving pieces of. And so I think those are the most challenging to review because it's more gray.
Thank you.
Thank you, Carl. Thank you, Stacy. I have my own question. So,
Yeah.
as part of the IRB, is it frequent that they are rejecting studies and then the researcher has to revise, or would you say it's more so approved? Which one would it
I
be?
would say that it is very rare that a study is submitted and approved without any changes going back and forth. I would say probably 98% have at least one set of changes to make. They might be minor. Most of the time they're minor, but sometimes they're significant. And I would say the other thing I didn't mention about an IRB is it's not just me that's on the IRB. So I'm managing the office that's responsible for this activity, but the studies that are considered greater than minimal risk, so a drug or device would fall under that bucket, goes to a committee of people that comprise the IRB. So it includes physicians, it includes um, statisticians, it includes nurses, and it includes also community members, because we want to have perspectives from everyone. And so studies that are greater than minimum risk go to that committee for review. And that's where we see the most significant types of things that need to be addressed because, again, our job is to make sure that the risks are minimized and that the risks are reasonable to the benefits. And so there's the most kind of significant substantive issues that are raised during that committee type of meeting that are sent back for our team to address.
Thank you so much, Stacy. And thank you for clarifying that the team includes like all the stakeholders so that everyone's understanding the parameters of the study. And then I have a question from Joey. Joey, do you want to go on unmute or do you want me to share it?
I'm a little bit sick, but why not? I was
Okay.
just kind of wondering, like, when you were talking about like significant and like small changes,
Yeah.
like what exactly would that like mean or like make up of?
Yeah. So, a significant change might be something like you can't do this many blood draws, or you can't or you need to add another MRI because you need to be evaluating the impact of this on brain function. So those are significant things that would have to kind of go back and forth. Minor things might be, okay, here are some edits to the consent form to make it clearer. And so those might go back and forth more readily, whereas something more significant requires, one, do we have the resources to actually do that at Connecticut Children's? So, do we have the people to do whatever the IRB is asking? Do we have the equipment that we need to do what the IRB is asking? Do we have funding to support that? Because every clinical trial, there's a cost to it as well. And so that's something I didn't even think about when I was kind of going through my training in research as a whole, is that it's not just doing the research. There's also a financial component of it, which is a completely different side of research that maybe one of you is interested in as well.
Thank you, Stacy. And
Thank you.
thank you, Joey. Stephanie, our amazing chapter leader, of Walter Payton, has a question as well. Stephanie, did you want to go on unmute or do you want me to ask the question?
Hey, this is Stephanie. I'm here in Chicago and I'm a chapter leader. Thanks, Abby. It's really cool that you're on the call today because I'm a researcher also at Lurie Children's Hospital.
Oh, fun.
And yeah, I was curious how your hospital incorporates voices of children and young people in your research.
Yeah, I think that we are doing a better job at this now than we used to. And so there's a lot of advisory groups that inform the research design, but it's not across all research. So there's certain types of research that really benefit. I mean, I think all research would benefit from um, having more voice of children involved. But I think that there's more impetus now to incorporate that, and there's kind of advisory groups that are set up either on a study basis or on a kind of topic area basis where they get feedback from kids y- about either the materials that they're using or even about the design. Like, we're going to ask these kids to come in to have their blood drawn weekly and at this amount. Do you think that's reasonable? Do you think there will be aversion to that? What do you think we can do to make it better? And so there are advisory groups now that are kind of set up in an ad hoc basis or more regularly. And then there's actually studies also that kind of incorporate the voice in more actively in the development of the study, kind of from start to finish. And so we see kind of a variety of ways, but I think there's always room for improvement of incorporating just participant voice in general. So something that we are working towards is having a survey that is not just completed by parents, but by children about their experience in the research process as a whole to really be able to kind of shape that moving forward.
Thank you, Stacy. Thank you, Stephanie. And then we have a question here. I'm so sorry if I say your name incorrectly. Alusoji, who has a question slash comment on recruitment. Alusoji, if you want to go on unmute. I think, oh, there we go. Asked to unmute.
Okay. Yeah, I'm an MD. I'm a researcher. I just wanted to say a question on recruitment while I have the ear of many young people. The last word right in his study, A is better than or worse than, or there's a percentage of people that have this if it's a descriptive study. Now, you can't use that phrase better than or worse than without a control group. And I just want to just put a shout out to research in general in that, if you get asked to participate and big if it's not intentional, as in you don't have to get blown, you don't have to have anything else done to you, helps the researcher develop a comparative because any findings can't be qualified. You have normal lessons children. And the that group, look at this for the 14 people, maybe 75% of females. So any comparison, say I was making a conclusion about the group who attended today, I would be short on male attendance and it would qualify what I could or could not say about whatever findings I had. So I think just a shout out, and Stacey, I don't know if there are ways, because when you say research and you want to be in a study, people think of nasty things happening to them. I don't know if there's any way as you release the assent forms, in big bold letters, this is a non-interventional study. Being in the comparator group will cost you nothing.
So we don't necessarily use big bold letters, but certainly we
That's my
look to
comment.
make sure that that's communicated to families, that maybe they're just being asked to be observed and just collect the information that's already being collected for clinical purposes. And there's some also circumstances that consent is actually not required. So there's or even assent. So if a researcher is trying to just collect data about a group of people, they might just do a medical record review, in which case consent is not a requirement for that, as long as there's parameters in place to make sure that that data is kept confidentially.
Hmm.
I don't know if that answered part of your question or not. It was a little broken on my end hearing. Um, I heard though that important to understand that there's different groups of people that are being studied, and the findings don't necessarily um, say that one is better than the other.
Mhm.
Thank you so much for your question and comment. And I'm going to go ahead and pass it off to Heather again. She has a question about long-term effects.
So I was just wondering what happens if a person has long-term effects after a research or project, similar to like when animals do, like with cat AIDS when they were testing for that when the cats became glow in the dark. Is there like compensation, or what do you do when someone has side effects that are lifelong? Like,
Yeah, so there's usually a period of time in which a researcher for a new drug or a new device is expected to be collecting information about what would be called adverse events. So things that a person is experiencing that you really don't want them to be experiencing. There's some that are going to happen, like every drug has some sort of side effects associated. But the researcher is expected to collect that information for a period of time, and it depends on what is involved. And then they're expected to communicate that back to the family. If there's something new that they found, like this is happening more frequently than we ever anticipated. Like everyone is getting headache and it's lasting for 10 days, and that's not at all what we expected. They're expected to not only communicate that, but maybe they need to make a change. Maybe they need to pause the study. Your question is more about long-term effects. So again, it depends on the length of the study and how long people are expected to be followed for. Sometimes it could be 5 years, sometimes it's 10 years. The compensation is a little bit tricky. So most consent forms will say that if you experience an adverse event, what will happen as part of that? And normally it's you go and get care. Sometimes a sponsor, normally there's for clinical trials, there's either a pharmaceutical company or a device company that's supporting the study, in which case sometimes they'll say that they'll pay for if someone is injured. That would be the terminology used as part of the study. But most of the time it's expected that what's communicated is that there might be these risks associated, and there's not necessarily going to be compensation to you as part of that. And it's really kind of institutional and kind of legal language that's put into the process to communicate what that might look like.
Perfect. Thank you so much, Stacy. And thank you, Heather, for your insightful questions. And I just want to give a shout out to Carl. So when we were asked that question about how specifically do kids provide feedback at Connecticut Children's, he specifically has helped in protocol design and also assisted IRB by reviewing advertisements and providing feedback through iCAN and our amazing chapter leader, Sharon Smith. So that's amazing, Carl. Thank you so much for everything that you do. And you are making changes in the pediatric landscape. And so,
Thank you.
thank you. Thank you, Carl. And so, with that, I want to ask you some final words of wisdom. So, Stacy, what final words of wisdom would you give to people who want to work in pediatric clinical trials, get involved in trials themselves, or focus on ethical research?
Sure. And thank you, Carl, for bringing that up, because I was remiss in specifically mentioning the local chapter, and that is certainly one of the advisory groups that we have in addition to some others. So, and Sharon is a great teacher and leader of that group. So to answer the question about the kind of words of wisdom that I might have, I think that it's really important to be open-minded to where your path will take you and to be curious, to ask questions, to explore and shadow as many careers as you can, um, as early as you can. So you can have those conversations now and get a sense of what people are doing kind of day to day and what their careers look like. I think for me as a kid who didn't have parents who went to college, I just looked at the kind of main careers that I knew about. And then I went down that path. And I think that asking a lot of questions and exploring different avenues is great. So being part of this group is awesome. I think there's also many aspects of pediatric clinical research. So there's obviously the local medical team who might lead a trial by recruiting or consenting and completing the study procedures. There's also, trials that are supported either by the federal government or sponsored by a pharmaceutical company or device company. So there's roles that exist on kind of either side of that or within an academic organization or hospital like I am. There's also a whole team of people that support research administration, which is kind of where I live, and kind of supporting, communicating with the research team, communicating with a sponsor, and making sure that the conduct of the study is taking place appropriately. So there's all different facets of it, and the ways in which to kind of see them, I think, is by doing kind of a volunteer opportunity or shadowing in order to get a sense of what that looks like. And if you remember at the beginning of the talk, I shared that as an undergrad, I shadowed the person I now work with, who Dr. DeMario, who is a pediatric neurologist. I was shadowing him really from a medical school perspective. I wanted to see what his day-to-day was like. And I, at the same time, had helped him do a research study on the informed consent process and what people understood after signing a consent form to join a research study. And so that kind of planted the seed for, I didn't know that they would emerge into this career, um, because I was still thinking I was going to go to medical school. But I had that kind of connection with him. And then after living in New York and looking to come back, there was a role at Connecticut Children's that had opened. And I connected with him and interviewed and kind of moved back to Connecticut. And here I am. So you don't know where your path will take you. And I think it's really important to foster the relationships that you have with people who you consider mentors around you and talk to as many people as possible and see where your path will take you.
That's beautiful. Thank you, Stacy, for sharing, especially emphasizing that, shadow as many careers as possible. That's something I also took into consideration when making my career choice as well. And just having lived experiences is the most important. And so with that, I want to personally thank Stacy for hopping on and sharing all your insights about your journey, career path. You are so amazing, Stacy. Again, if you want to learn more about clinical trial research, IRB, etc., possibly I can ask Stacy if she would be willing to share her contact information if you have more specific questions that you want to get into, because I know, again, a lot of our youth are very interested in research and definitely legitimizing their research studies as well. So again, thank you so much, Stacy. And then we are very excited for our next Ask the Experts, and we're featuring Michael Paperno, and he's specifically going to be speaking about leadership communication. So for all of you that are on today, definitely try to join that one as well. I think that he will provide so much insights about how to best comport yourself when speaking publicly or just participating in different leadership roles as well. So there's that opportunity. Also, I do want to mention our summit registration did go live as of February 20th. So you can officially register for the summit, and some of your chapters, you have stipends and you understand how many stipends your chapter got, but it is open. It will close on June 20th. Again, our summit is being hosted by our Canadian chapter, and that's from July 14th to 17th at the Delta Hotels. We're very excited and we hope to see you there. And then also you can scan the QR code to learn about different ways to support iCAN kids. But thank you again, everyone, for spending your Saturday with us. We hope to see you on March 15th. I will be sending an email with the choice to RSVP to the next event. We are hoping to see you there as well. Thank you again, Stacy. Thank you to all our iCAN members for hopping on. Thank you so much, everyone.
Thank you. Have a good weekend.
Thank you. Thank you so much,
Thank you,
everyone.
everyone.
Thank you.